All right, good afternoon, everyone. My name is Elizabeth, and I'm here from IMAC Insurance. We are the insurance broker for Nutley Public Schools, and this is the 2026 open enrollment presentation. We are the broker, as I mentioned, for the medical prescription and dental benefits for the district. And if you have a question about your benefits, whether it's a claim matter or anything related to open enrollment, you can certainly feel free to give our office a call at 973-450-9800, or you can send us an email at info@imacagency.com and we will get back to you. I know that I've already connected with quite a few employees that have had various questions about how the direct access plan works compared to the educator's plan, as well as on the contributions calculator, what their contributions will be after July 1st. So we are fielding all of those questions, but we will be talking about that a little bit more in detail today as well. So open enrollment began on the 27th and will be running through May 15th. And I apologize, I see a little typo on my slide here. You will have the same 4 plans available for open enrollment this year that you had last year, which include the direct access, the Omnia, the New Jersey Educators Health Plan, and the Garden State Health Plan. For those of you that were hired at the district, I apologize if you could just make sure that your microphone is muted as we are recording the presentation. For those of you that were hired on or after July 1st of 2020, the only options that are available to you are the New Jersey Educators Health Plan or the Garden State Health Plan. But for those of you that were hired prior to July 1st of 2020, if you're in direct access or Omnia, for example, and you're looking to go to the Educators Plan, that is certainly an option. And a rumor that I'd like to dispel is that some teachers or employees think that if they leave direct access that they can never go back to it, and that's incorrect. Every year you have an open enrollment opportunity, and your date of hire is what dictates what plans you're eligible to elect from. So if you, let's say, leave for the 2026-2027 school year direct access to go to the educators plan, but come next open enrollment, you'd like to go back to it, that's certainly an option for you because, again, everything is based on your hire date. So that's important that we wanted to just put that out there. On the IMAC benefits portal, which we are going to be referencing a lot, we do have a comparison of all 4 plans if you'd like to look at them side by side. And today we will focus on plan differences. I'm sorry, if you could just make sure that your microphone is muted. I apologize. It interferes with the recording. Today we will be focusing on the differences between the direct access plan and the New Jersey Educators and the Garden State Health Plan, as I know that most of the questions that we're fielding are just comparing, those plan options. So the New Jersey Educators Health Plan and the Garden State Health Plan both use the same network of providers as the direct access and the Omnia plan. So if you have in-network providers under, let's say, your direct access plan that are must-have for you that you can't switch, you don't have to worry about that if you're looking to switch to the educators plan, as all 4 plans utilize the same network of doctors. The Garden State Health Plan, however, has only coverage in the state of New Jersey. So if you're looking to have coverage, let's say, while you're traveling, or if you have a child that's away at college, the Garden State Health Plan is not a great option, as it limits you to only coverage inside the state of New Jersey. The Educators Plan and the Garden State Health Plan do have different ways of how they calculate your contributions because it is based on a percentage of your salary, whereas the direct access and the Omnia plans are based on a percentage of the premium. So every year that the premiums go up on direct access and on Omnia, for example, your contributions go up. But under the educators plan, unless your salary changes, your contributions stay stable. So again, that's an important distinction there, and why there is a savings moving from direct access to the educators plan, for example. Both plans have a $10 copay for your primary care. They have a $15 copay specialist for the specialist. For the emergency room, they have a $125 copay, but again, that's waived if you're admitted into the hospital. And the 2 big differences that we get asked a lot, like why are both plans so different, is that under the Educators and Garden State Health Plan, the out-of-network is reimbursed less than it is under the direct access plan. And the prescription is different as it has a different list of covered medications with a mandatory generics requirement. And we will be going over that in more detail in the upcoming slides. The Horizon BFIT gym reimbursement, that is also available for the educators and the Garden State Health Plan. So that's not something that if you leave direct access that you won't have available in the educators plan, for example. So when we talk about out of network in the educators plan, what that really means is that when you stay in network, you have a contracted copay with that provider. They cannot bill you anything above that. But when you go out of network, that provider, because they don't have a contract, can really bill whatever they want. And the out of network under the educators and the Garden State Health Plan reimburses less than the direct access plan, which is why it's one of the savings components is that the out of network reimburses less. So that's important to note because if you're someone in direct access and you're looking to switch into the educators plan, look at how you're currently utilizing your plan. Are you and or anyone in your family, for example, going out of network a lot? If you go out of network a few times a year, you're still probably going to come out ahead savings wise. But if you're somebody who has high utilization out of network, that's definitely something to pause and consider because you will be reimbursed less on those out of network doctors moving into the educators plan than you are if you're currently under the direct access plan. So when we talk out of network, this is a little example that I like to put together. For example, let's say that doctor bills a total of $100 for that out of network service. Horizon reviews that and determines what they would have reimbursed had that claim be in network. And in this example, in the blue box, we'll say that Horizon determines that the usual, customary, and reasonable amount was $50. Horizon will then, in the yellow box, pay their 70% of coinsurance, which is $35. You, as the member, you will pay your 30% in coinsurance in the red box, which is $15. But that other $50, that is still part of the total amount billed by that provider, which is here listed in that purple box, that's considered balance billing. And that's important to note because that is not subject or not applied to your maximum out of pocket. That is due by you to that provider should they choose to bill you. And again, this amount is going to be higher out of network under the educators plan than it is under your direct access plan. So utilization and how often are you going out of network is definitely something to think about. If this is something that applies to you and you are considering moving to the educators plan, give our office a call. We'll talk about it to see how in your specific situation, does it make sense for you to move to the educators plan? And then comparing all four plans to one another, as I mentioned in New Jersey, the network is exactly the same. So it is the Horizon Managed Care Network. The national network, however, again, in the Garden State Health Plan, it's only New Jersey, but the Direct Access, Omnia, and the Educators Plan all use the same national network, which is the Blue Card Network. The primary care copay, again, it lives in around that $10 range. If you're an Omnia, it's a $5 or a $10 copay. Your specialist copay, again, lives in that $10 or $15 range as listed on the screen. In network, your annual well visits or physicals are covered 100%. And out of network, and now going into deductibles and maximum out of pocket. So none of the plans have an in-network deductible. And out of network or in tier 2, if you're in the Omnia plan, you have a listed deductible there, whether it's a single or family coverage. And your deductible is the amount of money that you would lay out before the plan begins. Think of it like kind of like your car insurance deductible. So in network, it's a zero across the board for all four plans, but out of network, depending on whether you have single or family coverage. Your out-of-pocket maximum is the most that you would lay out in a calendar year, and you have different limits depending what plan you're in and whether it's in-network or out-of-network and single versus family coverage. None of the plans require a referral. Your labs continue to be the same as they are now across all four plans, being LabCorp and Quest are your in-network labs. Out-of-network or in Tier 2 if you're in the Omnia plan, you'd be subjected to the applicable deductible and coinsurance. Outpatient surgery in network is covered at 100%. Out of network or in tier 2, depending on the plan that you're in, you have a deductible and coinsurance. And your emergency room copay varies depending on the plan that you're on, but will always be waived if you're admitted into the hospital. For those of you with regards to prescription, if you're in Direct 10, you're laying out pretty much the entire cost of the medication up front. You're getting reimbursed 90% of that back. Same thing with Omnia. But for the educators plan, again, it is a different list of covered medications, which there is a link on the IMAC benefits portal that you can look up. But you have fixed copays where it's a $5 copay for generic and a $10 copay for what's considered a preferred brand. One of the drugs that we get asked about a lot is your GLP-1s, like your Ozempic, Wegovy, Mounjaro. All of those are covered under the educators plan at a $10 copay. Again, you do have to meet certain medical criteria for it, but they are covered, so something to note there. But we do have this link, which is for the net results formulary, which is the specific list of drugs for the educators and the Garden State Health Plan if you wanted to look up your medication, because it's important to note that the list of covered drugs is slightly different. And because they have that mandatory generics requirement, if you are on a brand that has a low-cost generic option, it's that low-cost generic option that's going to be covered. So I like to use Crestor as an example. Crestor is a cholesterol medication that is a brand. The brand Crestor is not covered under the educators plan, but the generic, which is rosuvastatin, that's covered at a $5 copay. So when I speak to individuals that are considering moving from the educators, from the Direct 10, excuse me, to the educators plan, for example, if you don't have an issue primarily staying in network and you don't have an issue with generic medication, it is a true win. There will be a savings for you. But again, everybody's usage and medical needs are different. So that's why it's important to really look at how often are you going out of network and what medication you and or your family are on to see if this will work for you, because at most you are committing for an entire calendar year or 12-month period if you move from direct access to the educators plan before you can actually move back. So that's important to note. And please, if you have any questions, please drop them in the chat. I don't see any questions yet, but feel free to go ahead and post that on there and we'll answer them as we're going through the presentation or towards the end. So as far as next steps, you can complete an enrollment form, or if you're waiving coverage, that is something that you have to do annually. So both forms are on the IMAC benefits portal. If once you complete them, they will be due back to the benefits@nutleyschools.org email address. But we highly encourage you to utilize the IMAC portal to evaluate the different plan options. And also we have the contribution calculator there that you can go ahead and review what your contributions would be. We do have a link on there for you to go ahead and figure out participating providers. But like I said, all 4 plans utilize the same network of doctors. You are making a plan election now for July 1st through June 30th of next year. And your next open enrollment period would be May of 2027. And again, the deadline for open enrollment is May 15th. And please, again, that would be going to benefits@nutleyschools.org. That is the email address. But as we've been mentioning, the IMAC benefits portal for this district is Nutley Public Schools. So if you go to imacbenefits.com and you type in Nutley BOE, you will go ahead and see all of the information that we've talked about right on the landing page. We've created an open enrollment section that you'll see everything, including the contribution calculator. The contribution calculator is an Excel-based calculator, so you do have to have Excel 2013 or later. If you're trying to use it with Google Sheets, it will not work. So please feel free to call our office or email us. We can certainly reply back or answer your contribution questions just to compare what your Direct 10 cost will be as of July 1st versus, let's say, the educators or any other plan that you're considering. But again, we can do that research for you. And while this is open enrollment for you to go ahead and make any changes, we do understand that life happens outside of open enrollment. So you do have 30 days to go ahead and make a change on your benefits if it happens outside of open enrollment, with the exception of newborns, which are now 90 days as part of a new New Jersey state mandate that was passed this spring, actually. So depending on whether it's a marriage, a divorce, or God forbid a death, or the birth of a newborn, you do have a certain time limit to complete and submit your enrollment form and documentation to go ahead and have that coverage be put in place. If you miss those deadlines, you would have to wait until the following open enrollment period to occur. But you do have a certain defined period of time to, let's say, add on a new spouse or add on a newborn baby to your plan. And again, open enrollment will take place every May, with changes being effective July 1st. For those of you that have dependent children that will be aging out, they age out at the end of the year in which they turn 26 for medical and prescription, or until the end of the calendar year in which they turn 19 for dental, unless they're a full-time student, which at that point they would age out at 23. At the end of the year that they age out, they will have the following coverage options, which include COBRA, Chapter 375, which is a New Jersey state mandate that we'll go over on the next slide. And if you do have a special needs dependent, there is coverage continuation for overage children with disabilities. We do have a form on the IMAC benefits portal, so you can always refer to that, which includes the instructions that you would need to complete, as well as your doctor, if that's something that's applicable to you and your dependent child that is aging out. But again, always feel free to give our office a call with regards to any questions about that. Chapter 375 is a New Jersey state mandate that if your overage dependent is not married, has no dependent children of their own, lives in the state of New Jersey, or is a full-time student outside of the state, and is not entitled to any other group Medicare or coverage, they're able to go ahead and stay on the plan that you are on for medical and prescription only until they turn 31. We mentioned Chapter 375 because it is much less expensive than COBRA, although it's still pricey. So that's something that is an option. I can tell you that as we've looked into the numbers for employees, especially with the last year of increases on the government marketplace, the prices are kind of similar to what you're seeing on the Government Affordable Care Act. So something to consider if that's applicable to you. But again, we do have a link on the IMAC benefits portal with all the information about this program. And if you have any questions about it, you can always feel free to give our office a call. For anyone who wants to go ahead and do a search on doctors and or providers in your network, maybe you're looking for a new provider that for a newly diagnosed condition, we do have that link on the portal as well, but you can go to horizonblue.com/doctor finder, and you can do a search for any of those provider needs based on your location and on the plan that you're in to see if they participate. We also have the gym reimbursement that is available for all 4 plans, and that's the Horizon B-Fit reimbursement. So if you go to the gym 12 days or more per month, you can go ahead and sign up for a $20 reimbursement up to $240 a year for going to the gym, which if you are doing that, definitely something to take advantage of. Also, as a Horizon member, you do have discounts that are available by going to horizonblue365deals.com. And that is something that's available to all Horizon members, no matter what plan they're in. And they offer some pretty great discounts on gyms, sneakers, meal delivery services, even things like LASIK eye vision discounts, or even hearing aids I've seen. So that's another neat feature. And if you do have a smartphone, it's important that you download the Horizon mobile app. I like to use it personally because if I forget my ID card, it's great to be able to pull up a digital copy of your member ID card right on your cell phone so that you can get at the horizonblue.com address. With that said, that really brings us to the end of our presentation. I don't see any questions in the chat. Holly, is there anything that you'd like to touch upon that maybe you want to reemphasize? Again, open enrollment does end May 15th, and that's something we'll definitely highlight again. But Holly, I'm not sure if there's anything else you'd like to add. Okay. All right. Well, with that said, we will share a copy of this link with everyone. Go ahead, Holly. I'm sorry. I wasn't sure
No,
if your
I
mic
just
was
wanted to
working.
say thank you, Elizabeth. This is amazing. Very good information. I took a few screenshots myself. So it's
Perfect.
good refresher.
Good. No, and we'll share this link tonight, Holly. We'll post it on the portal as well. And then
Perfect.
Holly can email it to everyone who maybe wants to view it again, or any of your colleagues that couldn't make it live tonight. But with that said, I appreciate everyone's time. Again, feel free to reach out to us. There are no dumb questions. And we want to make sure that you have all the information that you need before open enrollment ends, so you can make an informed decision on your coverages. Thank you so much, everyone. Have a great rest of your evening.